So a very good afternoon to you all. Welcome to another LSBU Menopause Focus event as we continue to kind of break down the taboo and open up conversations around the menopause. This is Let's Talk Menopause Information Overload. I'm absolutely delighted to be welcomed by the incredible Ruth Devlin, founder of Let's Talk Menopause. Ruth spoke at an event last year, and she's been a real kind of like support for LSBU, and it's been great working with you, Ruth. And delighted to welcome you on campus today. Ruth is going to be talking a lot about where to get the information out, the good, reliable information out there, because there's so much to take on board. So my name is Neil Hudson-Basing. I'm the corporate events manager at LSBU, working with colleagues across LSBU on our menopause related activities, from our menopause cafe through to events, policy, and all the things that we've been rolling out support-wise for colleagues and beyond, for our students, local community, and anyone else that needs it. Just to take you through the virtual housekeeping, starting with a short statement on respect and dignity. Anyone speaking at an SBU event, whether in person or virtually, should be treated with respect, dignity, and courtesy. We operate an environment built on equality, inclusion, and acceptance. We value contribution and feedback and comments, and wish to create a space for sharing, learning, celebrating, and bringing communities together. Please be kind and respectful to other guests. We will reserve the right to remove anyone who isn't. I'm sure that's not going to be a problem for today. We'll have a nice, warm, and inclusive event. So thank you for that. Just to take you through the functionality, we're in Zoom Pro, which means you can turn your cameras and microphones on later to ask questions and get involved in some active dialogue. We encourage you to do so, but if you could just hold off till after the presentation, and we will stop recording there. You'll see that I've enabled closed captioning, which are the subtitles that you can see appearing on your screen. If you don't wish to see them, you can click on the little up arrow next to CC Live Transcript at the bottom of the screen and choose to hide subtitles. But we do enable those in the interest of inclusivity and accessibility. That's all from me. I'm going to be around later to help facilitate the Q&A and the discussion. But Ruth, without further ado, I will hand over to you.
That's great, thank you. Now let's see if I can share my screen. Okay, hello everybody. I'm delighted to be back here today. Thank you very much for having me. Let me just 2 seconds while we'll just whirl into action. Let me get this up. There we go. How's that, guys? Can you see that all right?
We can.
You can? Excellent. Okay, so just thank you very much for the introduction, Neil. That's wonderful. And as Neil said before, please just fire away with the questions, and I'll try and leave as much time as I can at the end of that, at the end of today. So let's just get going. So first of all, what I'd just like to get across to people is, let's just see how everybody views the menopause as a topic. And this is a really interesting quote. It was from one of the past Indian Menopause Society's conferences. But in menopause, we're not aging, we're ripening to perfection. Isn't that wonderful? So for me, this sort of sums up how I'd like people to view the menopause. Obviously, we're all aging. Obviously, it's just a phrase. We're all evolving and aging, but that ripening to perfection, seeing the menopause in a more positive light, seeing the menopause as not a taboo topic, not something to be feared, not a stage of life to be feared, but just a time of life which you approach in a more positive fashion. But I think you can only do that if you're fully informed and you're prepared, because some people do experience really debilitating symptoms, and it's quite hard to feel like you're ripening to perfection. Other people don't, but we'll move on to that. But if you just keep that quotation in your mind as we're going through the talk, you'll see what I mean as we go along. Okay, so information overload, my goodness, here we go. This is what it can feel a bit like to people, isn't it? So you've got celebrities jumping onto the information level at the moment in the education. We've got a cohort of celebrities who have reached a certain age. And if you listen to some of them, you'd think that nobody has ever talked about the menopause before in their lives. And they're all writing books, which is wonderful because they are raising awareness. It's fantastic. But how they get their information across sometimes can be a little bit of disparate information, things like that. So err on the side of caution there. We've got educators like myself. Make sure that they really know their stuff. It's evidence-based, it's accurate information. We've got menopause cafes, wonderful events. We've got lots of safe social spaces where people can go and talk about the menopause, and not only the menopause, about women's health in general. We've got numerous books on the market. We've got people calling themselves menopause experts. Be wary of people there on that line. I would just say err on the side of caution. Are they an expert? I wouldn't call myself an expert. If I've been called an expert, it's by somebody else, it's not by me. There are very, very few experts in the world out there. There are definitely menopause specialists, trained specialists. So yeah, but I would just make sure that they're all accredited. So it gets very confusing, doesn't it? Multiple websites trying to do the same things, multiple support groups, forums. There's a tricky one as well, because forums are wonderful for raising awareness and for providing support for people, providing an initial support for people. But when you're wanting to get accurate evidence-based information across, sometimes they fall down a little bit there. But just provided a cluttered screen, because that's what it can feel like a little bit when you're trying to get information for yourself. So hopefully today, the end of today, hopefully you'll feel a little bit more informed and a little bit more motivated to self-manage symptoms, but feeling like you feel a little bit more confident going out there to look after yourself as well. Or if you're supporting somebody who is experiencing the menopause, or within the workplace or outside of work. Okay, so I'm just going to run through a few basics. Everybody on this call will be at different levels of information and knowledge on the menopause. So literally for 2 minutes, I'm just going to run through a few basics. So bear with me if you know all this already. It will just take 2 minutes. So every woman will go through the menopause. About 75% of women, of people experience symptoms, but to very differing degrees. And that's where the complexity starts. Then you've got this cohort of women, about 25%, who seem to just sail through this time in their lives, don't they? They don't have a care in the world, their periods fizzle out, they just transition, move on into the postmenopausal years without any problem at all. And that adds to the complexity. Adds to the complexity for people who, for everybody who's experiencing the menopause, but also adds to the complexity for healthcare professionals, because think how many different unique experiences of experiencing the menopause do they have to cope with presenting themselves in their surgeries. So you've got to remember, you've got estrogen receptors throughout your body, in cells throughout your body, which is why there's so many different body processes, body systems, which are affected by your estrogen levels declining. So that's why you've got over 34 different symptoms associated with the menopause. You can split them up into different categories. You've got physical ones, you've got psychological, emotional ones. I'll mention these in a minute, so don't worry. And then you've got some of the long-term ones, like the genitourinary symptoms, everything to do with the vaginal area, the external vulva and the urinary tract, and then other potential long-term symptoms like osteoporosis and other rare symptoms as well. So there's an enormous array of symptoms which potentially could be associated with that declining level of estrogen. The average age is 51 years. If you're classed as being prematurely menopausal, also known as premature ovarian insufficiency, that's POI, then you'd be 40 years and under. If you're in an early menopause, it's around the age of 45. The aim for healthcare professionals is that everybody should receive holistic person-centered care. With the backlog of work with COVID and everything, it's not possible. It really isn't possible. So if I can give you enough information today, a good comprehensive overview, and give you some really good signposting and resources to look into, hopefully you'll feel a little bit more armed to be able to start giving yourself that holistic person-centered care. Okay, a few more basics. Menopause you can only be classed as being fully menopausal when you've had 12 consecutive months of no bleeding after your last menstrual period, LMP. It is a transitional stage from your reproductive stage to your non-reproductive stage, and symptoms are caused by declining levels of estrogen. But in addition to lots of other things going on in your body, you've got other hormones that are fluctuating around. You've got progesterone, you've got testosterone, you've got your stress hormones, elevated levels of cortisol and adrenaline, adding to that imbalance. And then you've got so many other different factors as well, which contribute to not only how you experience symptoms, but then how you cope with symptoms. And we'll go into what I mean by that a little later. There's different types of menopause. You can go into menopause naturally, so spontaneously, or you can be thrown into an immediate menopause if you've had surgery. So you've had your hysterectomy and you had your ovaries removed. or if you've had treatment like chemotherapy, radiotherapy, which can damage the ovaries. And it's that rapid decline of estrogen, which is said to cause the more intense symptoms of menopause. And if you are going to have to experience treatment like this, or if you know of anybody who needs supporting through having treatment like this, then make sure you've got a game plan in place, or they've got a game plan in place. That's the most important things. Surgeons are really good at their job. They're good at doing the surgery, or providing the medical treatment. Sometimes, not always, sometimes they're maybe not thinking about that aftercare, and they're thinking, right, okay, they're going to be thrown into a menopause here. Let's make sure they've got a game plan in place for that as well. So if you don't have a game plan, make sure you find somebody to help you get that. Okay, so what can affect symptoms? Well, lifestyle choices, diet and exercise are massive when it comes to any health condition, but particularly with the menopause, and these are things that you can really start doing for yourself. You might be thinking, I've not come on the call today to talk about lifestyle choices, but I'll tell you why they're important in a minute or two. Asian culture, well, the Asian continent experience lower reported rates of menopausal symptoms. That obviously can be from a certain cultural level, but also they do have tremendous food sources, lots of phytoestrogens in the diet. So there's lots of research going on with diet and everything as well in that sector. Alcohol, smoking and drug abuse obviously affect any health condition. Your family history, your genetics, well, it can follow down your maternal side that if your mum or your grandma has experienced an early menopause, you might experience an early menopause or a late menopause, but it doesn't always follow. You might have 3 sisters within one family. One will experience an early menopause, the other 2 won't. So it doesn't always follow. Okay, I just want to quickly run through all the different stages of menopause. And again, you might know this, but I just want to focus on one particular stage just to clear a couple of misconceptions up. So your hormones, most of us have all our hormones in balance in that premenopausal stage, that reproductive stage, and then your estrogen levels start to increase their decline and you start going into this perimenopausal stage. It's the most symptomatic stage prior to becoming fully menopausal. You can only be classed as being menopausal when you've had 12 consecutive days of no bleeding after that last menstrual period, after which you go into the postmenopausal years. Let's go back to the perimenopausal stage. It's really important that you understand that your hormones don't steadily decline. Nothing happens simply, does it? They fluctuate as well, which is why one day you might feel really rubbish and you're experiencing a multitude of different symptoms. 3 days later, they're fluctuated. And maybe your stress hormones aren't quite as high, your cortisol levels and your adrenaline levels a little bit lower and more imbalanced, and you're not feeling so bad. So you're thinking, oh, that's a little strange, what's going on here? So remember that word fluctuating, okay, as well, going through. The perimenopausal stage, how long does it last? It lasts as different lengths for every individual. Average 4 to 7 years. Some people say 4 to 10 years. It really does depend just on your individual physiology and how your body's coping with those estrogen levels declining. A couple of misconceptions I want to sort out. A lot of people think that they've got to get themselves through this stage before going and seeking help and advice from the healthcare professional. A lot of people will think maybe, you know, you've tried all the lifestyle choices, you've tried complementary therapies to help with your symptoms, tried alternative remedies, things like that. You think, well, maybe I might need a little bit of extra help. I might need to go and see my GP. Maybe I want to talk about, maybe thinking about HRT, something like that. And they'll put it off until they're getting in that postmenopausal stage. No, absolutely not. You can have HRT, you can have other non-hormone medication when you're still having some form of menstrual cycle. So it's never too early to go and seek help and advice. Your symptoms do not have to be severe for you to go and seek help and advice. So keep that in mind as well. So let's do a little bit about the workplace. How does menopause affect within the workplace? Well, we weren't designed to live this long. Back in the early 1900s, our life expectancy was around 57 to 59, and we menopaused a lot later as well. But thankfully, due to our knowledge about nutrition and all the medications that are available now and the environmental factors as well, that our life expectancy is around about 83, and we are menopause earlier at 51. But this means that we predominantly are still within the workplace when we are experiencing our symptoms. The majority of us are still within the workplace experiencing our symptoms, and while we're transitioning from the start to the finish of this period. And that can cause a lot of hassle for a lot of people in different ways. So some people, as I said before, have really mild symptoms. They can cope with that with minimal support. But other people do start to experience a whole range of symptoms. It can be incredibly debilitating, some of the symptoms. And I think, you know, the word distracting, let's think about the word distracting. How distracting can it be as well? Not only distracting, as well as not only embarrassing, but distracting as well. So symptoms causing embarrassment. Everybody knows that. It's, you know, hot flushes for one person, it might be a warm glow. Other end of the spectrum, you're literally dripping in sweat within 2 or 3 minutes. And that's incredibly embarrassing, isn't it? Well, you know, some people, everybody experiencing things very different ways. If you've got problems with your menstrual cycle, you know, some people's periods just fizzle out and fade out and you get spacing in between. Other people, the other end of the spectrum, you've got people experiencing periods every 2 weeks, multiple periods within a month, and they might be having cramps and huge amounts of blood loss. You might be experiencing flooding. Extraordinarily embarrassing if we're back within the workplace. You're just sort of starting to come back into the workplace now, and that can be really debilitating as well. It's not only embarrassing though, but if you are experiencing these symptoms, that can be distracting. They're irritating, they're annoying. You don't choose to be within this stage of your life. You don't choose to have these symptoms. That can get very irritable, but also you just, a lot of the time, you don't want to be feeling this way. You know, I think it's important to point that out to a lot of people, is that women in this transitional stage, you don't choose to have these symptoms. You don't want these symptoms. You just want to go back to feeling how you used to be prior to your hormones getting all out of balance. And that's a really important thing to get across, particularly to within the workplace, that, you know, people, if you're not quite up to speed with how symptoms can really impact your life and your work, that's really important. And it can give, for somebody experiencing a lot of symptoms, you can tend to feel a little bit out of control, which can be really debilitating as well. So some people can feel that they need to change their role within the workplace. Some people, you know, some people feel that they have to take time off work for their symptoms. They might be experiencing insomnia. They might be being woken up by multiple night sweats, by having to get up to the loo more, by nocturia. They might be, you know, that adds to that feeling of fatigue. There might be all sorts of different symptoms, which means that they just don't feel like they're coping within the workplace very well, that they might have to take some time off work. And unfortunately, some people do take early retirement. So how can management help? Well, definitely acknowledge the menopause as a long-term health condition. Make sure you've got your menopause policy in place, but make it an accessible document, a realistic document to be worked with. You know, there's no point in putting reasonable adjustments, you know, these practical measures within your policy if you can't easily facilitate them and put them in place. So any reasonable adjustments which are put down in a policy, you need to be able to activate just like that for somebody, because it's being able to support people adequately through this transitional period. So sometimes, I think a lot of the time, people will want to change roles within the workplace. They'll take the time off work, they might take that early retirement, and they've never managed to have that conversation with management. And sometimes it's not the management's fault. Sometimes the person just doesn't feel comfortable having a conversation about something which they feel is a very personal matter. That happens, definitely, but also management likewise don't make themselves accessible or open to having that conversation. They might themselves say, well, I'm open and accessible, but they've not made it known to all staff and colleagues. So it's sometimes a really good idea to maybe appoint a key figure within your organisation. You can call them a key figure, you could call them a menopause champion, you could call them a menopause warrior, whatever you want to call that person. You could call them a women's health listener, anything at all, which means that somebody knows that person is willing to talk about this topic. They're open to talking about the topic. You know that they're an open person. You know that they're informed. They don't have to be a specialist in the area, but they know what your organisation is prepared to put in place to help support through this time. So things that you could put in place, things like the key figure. You could make sure that every month, start off with once a month, maybe creating a safe space within your organisation so that people can go at a certain time, maybe for about an hour long, people can go and talk about menopause, but not just about the menopause. It's really important to encourage all ages on this topic, and that's really, really important, so that the younger age groups don't slip through the net. So you're wanting people to encourage people to get informed so that they're prepared for this stage in their lives, but also you don't want people, say, suffering from endometriosis or polycystic ovarian syndrome or going into a premature menopause. You're wanting to point out, like, just, you know, tweak people's information levels and say, well, if you've not had a period for 3 months, maybe you should be going and seeking advice on why you've not had that period for 3 months, because that's a red flag symptom that you might be, you know, going into a premature menopause. So it's getting that information across and making it inclusive for everybody is really important. Getting men on board, as Neil said at the start, we had a men only session, which was really interesting. And I always suggest any organisation, if you don't have many men attending sessions, well, they're not attending for various reasons. It's not because they're not interested a lot of the time. It's maybe they're open to the fact that if people are on the line and they might feel sensitive about talking about personal issues, they might not want men on the line, so they don't attend. They think, well, it's a women's issue. I'll stay off that one and I'll try and get my information from somewhere else. So sometimes providing men only sessions can be a really good way of helping with that, helping them get informed. Usually they're really interactive. Usually they're well attended because they want to know as much as everybody else. They've maybe got perimenopausal staff to help support, and they've also got perimenopausal partners and wives at home who they're trying to support as well, and they're desperate for information. So just providing information which is easily accessible is really good. Okay, so I'm just aware of time, so I'm just going to zip on to some of the symptoms. So we're not going to go through each different symptom. So these are the classic groups of symptoms. You've got your physical symptoms, the classic ones like the vasomotor symptoms. You've got your hot flushes, your night sweats. You've got, these might be accompanied by palpitations, by headaches. Headaches are really common when you've got hormonal imbalance, okay, and palpitations as well. But if you go along to see your GP, they're going to have to exclude other reasons why you might be experiencing these symptoms. So always a little bit of patience with your GP if you go along to try and find out why you're having these symptoms. So when you're thinking about things like your vasomotor symptoms, you want to be thinking about, okay, how on earth can I cope with these? With any of these symptoms, any of these groups of symptoms, you want to be looking at your lifestyle choices, thinking about your dietary sources, thinking about making sure you're well hydrated. How much caffeine have you got in your diet? You know, how much caffeine are you having? Caffeine is a stimulant. So when you're thinking about the hot flushes and night sweats, you're thinking about, right, okay, what's triggering those? Because a lot of the time it can feel like they're completely random, can't it? But more often than not, they're triggered by certain things, or they're exacerbated by certain things. They're made worse by certain things. So stimulants, definitely things like caffeine, not just the hot teas and coffees, your caffeinated fizzy drinks as well. Alcohol is a prime one, particularly red wine. It's all the nice things in life. Things like spicy foods, definitely. One of the huge ones is stress. We'll talk about stress in a minute. So trying to get a control on those stress levels, really easy thing to say, isn't it? But we'll look into that in a minute or two. So it's looking at all the lifestyle choices, first of all, with any of these things is really important, because that's something that you can do yourself, something that gives you that element of control back as well. Other things like alternative options, like cognitive behavioural therapy, fantastic complementary therapy to get into. And I think a lot of people will get put off CBT because of the word therapy at the end there. They'll say, well, I don't have a psychological problem. I don't need to have therapy. But it's a very different from other therapies. It's very much looking at everyday problems and just using simple practical tools and strategies to help you cope with that, mainly to reduce your stress levels. Okay, so if you find something where you can help to reduce and maintain low stress levels, that is key to a lot of these symptoms. You've got your psychological emotional symptoms. Even with raised awareness about mental health, as we all know, there's still a stigma attached, isn't there, with a lot of people, and they just don't want to admit, particularly within the workplace, they don't want to admit that they're finding it really, really hard to remember things. Their memory is poor, their concentration levels, you know, that just the time that they can maintain a good level of concentration is being massively reduced. They feel like they've got a grasshopper brain, and then they're feeling extremely irritated by various things, which they normally wouldn't do. And also having those fluctuating hormones, feeling bouts of rage and anger is really common as well. But there, and also having low moods, very different from full-blown clinical depression. So I think separating that out as well is quite, some people do experience depression, but the word depression is bandied around quite a lot. So I think separating those two out, is it low moods rather than you are fully depressed? And I think that's really key to trying to establish what level you're at. But definitely, again, huge isn't there connection between your gut health and your brain health, making sure you're feeding those trillions of microbiomes in your gut a good variety of foods. And that doesn't mean having large platefuls of food. It means having as many different varieties in there as you can, with tiny little bits. I'm meaning things like, you know, if you take breakfast for instance, you might have a bowl of cereal, you might have that with cow's milk, soy milk, almond milk, whatever, but what else could you add to that? You could add a dessert spoon of flaxseed, ground up flaxseed. You could add blueberries. You could add a spoonful of natural yogurt. You immediately incorporated 3 more different things, giving your microbiomes a bigger variety of food, because the more variety those microbiomes get, the better that they can work, which then helps with that brain health. Not very scientific, and a very brief, we haven't got long, but a very brief explanation of why it's really, really important to get a good variety of food into that diet. But then again, anything to do with psychological, emotional symptoms, they're going to get exacerbated. They're going to be made worse by high levels of caffeine, alcohol, no exercise, not being well hydrated. These are really simple things that you can start to do yourself as well, which is important. Those genitourinary symptoms, a topic that a lot of people don't really want to talk about, but having been a nurse and still a registered nurse, I don't mind talking about them at all. And they are the symptoms that are the most underreported and undertreated, and can really impact your lives. So it's why a lot of educators, we're really passionate about those, because sometimes they can be really, for the majority of people rather, they're really easy to treat. So when you're thinking about those genitourinary symptoms, first of all, think, well, okay, I don't have to put up with these symptoms. So things like frequency, urgency, leakage, nocturia, getting up in the middle of the night, what can you do for things like this? Well, the estrogen declining, remember I said we've got estrogen receptors throughout our body, so we've got lots of estrogen receptors in this area, and that can affect the urinary tract to a certain extent. But also you've got to think about things like your pelvic floor muscles. So the pelvic floor is a group of muscles. It's attached by ligaments, acts like a sling, supportive sling. And a lot of people, a lot of us, I've had 3 kids, a lot of each put through an awful lot of pressure when you have children. And it's like any muscle. When it's worn out, it needs exercising, you know, but it doesn't just need exercising once. It's something that you need to exercise every day of life. I know, hopefully you're all sitting online and you're doing a pelvic floor exercise. Men as well as women, I might say, but just more predominantly with women who particularly have had children. So if you are experiencing frequency, urgency, leakage, and particularly getting up in the middle of the night, you know, you're wanting to be thinking about definitely doing those pelvic floor exercises. So definitely do things like download the Squeezy app, the best $2.99 you spend. It's an NHS app. I'll put it in the resources at the end. Designed by physiotherapists who specialise in this area, give you timed exercises, explain how to do a pelvic floor. We'll go into that if we've got time at the end. Really, really important. But other problems with genitourinary symptoms, things like vaginal atrophy, thinning and wasting away. So your tissues become thinner and less elastic in this area with these declining levels of estrogen. So that can result in irritability, dryness, soreness, all these sorts of things. And also it can change the acidity in your vagina. So you might become more prone to infections, very common. And also like bacterial infections, like UTIs, and also urinary tract infections, and also fungal infections like thrush, things like that. Very common to become, more prevalent at this time of your life. So it's being aware of these things and then thinking, okay, that's fine saying it, but what can we do about it? Well, first of all, think about that word dryness. So you're thinking about comfort, and maybe intercourse has been affected as well, and it's very uncomfortable, and that's you're having a leakage, and that's putting you off exercise. It has knock-on effects, so it's really, really important to address the situation. So think about if you have any dryness on any other area of your body, what do you do? I bet everybody's used a facial moisturizer or a body lotion or a hand lotion today. We used so many different products, don't we, in this area? And it's the same for this area of your body. There are there are particular moisturizers designed for the skin in this area. So please don't go slapping on your body lotion or your facial lotion. You've got moisturizing lubricants designed for this area. It's a big business. There's a myriad of different products out there. So find one which suits your physiology, and that's a good starting point, because you don't have to have that prescribed. Find one which they normally are paraben free and hormonal free, definitely hormonal free. Most of them are paraben free. Just make sure you choose one which you could use every day, and then just build it into your daily life. One company that don't pay me is called Silk, SYLK. You can have that prescribed, but you can buy it online in Boots. Really good product. But the best treatment in this area is vaginal estrogen. Now, vaginal estrogen is a tiny, tiny amount of estrogen. It is different from systemic HRT. You've got to understand that. That's why they're hopefully going to bring it in to be available over pharmacy counters. So, tiny, tiny amount of estrogen. It's such a small amount of estrogen. You don't need the protective element of that progesterone component. You do have to have it prescribed at the moment, but it's a localized treatment. It's going exactly to where it's needed. And for the majority of people, it's really, really successful and has very low systemic absorption. Because it's so tiny, you need to give it time to work. So make sure that you're not just trying it for 2 or 3 days, that you use it continuously for 2 weeks, and you might not even see the full rewards until 3 months down the line. Okay, I could talk about genital urine symptoms for a long time, but we'll just quickly go back to physical symptoms, because I only mentioned the vasomotor symptoms. You've got problems with menstrual cycles. If you're having any problems with your menstrual cycles, don't hold off and put up with them. Make sure that you go and seek advice, because there are certain things that your GP or your practice nurse, if they're prescribers, that can do for you. So if you're having extraordinarily heavy periods, you could have non-hormonal treatment like tranexamic acid, which will help with clots, with cramps, help with that flow of blood. You might not fancy that. You might fancy having a hormonal therapy, something like maybe you fancy having a Mirena coil fitted, which releases progesterone. That has the added benefit of providing your contraception. Or you might not fancy that. It might be more suitable for you to have a small surgical procedure, an endometrial ablation. So there's lots of things that you can have. And I think with any of these symptoms, it's really important to know all the different options available, isn't it? And then we've got problems with insomnia, with sleep patterns. Well, before starting to think about medication, think about, okay, what can I do for myself? Am I giving my body a real chance to have that good night's sleep? Have I got good sleep hygiene? Very odd term, I always think, but sleeping specialists will always come out with that. So, is my room cool, dark, well ventilated? Do I have all my LED screens out of that bedroom? My bedroom's for sleep and sex only. I don't have any tellies in there. I don't have a laptop in there. I don't have my phone in there. The LED screens contribute to a poor night's sleep. The worst thing you could be doing is sitting on your laptop with a glass of wine, with your watching a horror movie with your phone on speed dial. That is the worst thing to do. You want to be doing the opposite of that. Shut down your LED screens at least an hour before you go to bed. Make sure you have a good, calm lead up to bedtime, that you're doing something relaxing, that it's not stimulated before bedtime. So maybe listening to a podcast, reading a book, having a bath with aromatherapy oils in, something like that. Something relaxing. Give yourself a chance to have that. And then we're thinking about things like bone health as well. Really important. Are you giving your body a chance to have that good bone and heart health, which is slightly compromised when your estrogen levels are starting to decline? Not for everybody, but I think going back to within the workplace, getting that younger age group in to talks and things is really important, because then they're preparing their body for this time. So you're wanting to make sure you're eating a diet which is rich in protein. Protein encourages the natural production of collagen, one of the building blocks of our bodies. Make sure it's calcium and magnesium rich, which is really good for your bones and your heart health, but that you're having that vitamin D supplement, which helps to process the calcium. Most of us don't process enough vitamin D, so that's the only supplement I definitely advocate taking, is vitamin D. And then you've got other potential long-term symptoms, things like osteoporosis, things like that. Not all of us are going to go on to develop osteoporosis, but it's that thinking in advance of, okay, how am I going to prevent myself from getting osteoporosis? Okay, I'm going to have a really good diet. I'm going to make sure I've got that calcium and magnesium and protein in my diet, that vitamin D. I'm going to make sure I'm well hydrated. I'm going to limit my levels of caffeine and alcohol, and I'm going to make sure that I do a good amount of weight-bearing exercise every day. Okay, really important. I'm just aware of time, so we're going to skip on. So how do you manage symptoms? Well, naturally through lifestyle choices, diet and exercise. You've got alternative remedies like herbal remedies and supplements. You've got alternative options, CBT, cognitive behavioral therapy. You've got non-hormonal medication, and you've got HRT. This slide is probably one of the most important slides, though, in the whole presentation. Practical ways to cope with stress. If you can get a handle on how you can help yourself to cope with lowering your stress levels and being aware of what your stress levels are like and your coping mechanisms, you're halfway there to really helping yourself. So the classic things like making sure you get enough exercise, making sure you get out in the fresh air. Hard in central London. I usually am contributing to webinars and I'm surrounded by fields. I'm very lucky, I realise that. But you've got so many parks. I've been trudging around parks, St James's Park, Hyde Park, and just getting out there and experiencing nature is really, really important, even if you just do it for 15-20 minutes at the end of a day. So exercise definitely helps to regulate those hormones and has so many benefits, we all know. But you don't have to become a lycra-clad gym bunny, do you? You can just do anything. You could skip, you could do 10 minutes of high intensity exercise. Lots of my friends, complete and utter couch potatoes, but you give them a skipping rope, they'll do 10 minutes of skipping in the morning, or they'll do 10 minutes of hula hooping with a weighted hula hoop, or there's some fantastic dance apps online as well. Anything where you can sustainably do exercise throughout the week is really good. Breathing. Yep, we all breathe. I know that. But how do we breathe? If we're stressed, how do we breathe? The good example of somebody who's extraordinarily stressed, aiming, heading towards a panic attack, they're doing very shallow breathing, aren't they? Their chest is going up and down rapidly. So you're wanting to do the opposite of that. So if you feel like you're getting into a stressful situation, or if you feel a hot flush coming on, you can reduce the intensity of that hot flush if you help yourself to reduce your stress levels. And that's simply done by practicing paced breathing. So paced breathing is the way that you're breathing. If anybody does yoga and Pilates, you'll be well versed in this, but it's making sure that how you're breathing. So if you're breathing in through your nose, you're not raising your chest, you're blowing that tummy out. And if you're counting your breath in, you're counting your breath out, you immediately start slowing your breath down. By blowing your tummy out, you're taking in more oxygen, and that will then start to have a benefit on lowering your stress levels. Very simply said, but if we've got time, we'll do some paced breathing. But it really does work. It genuinely has been proven to physiologically reduce your stress levels, but it's helping reduce the impact of all those symptoms, like your hot flushes and your night sweats, particularly at night. You can exacerbate those night sweats by getting really angry and irritated about it, raising those cortisol and adrenaline levels. Do the opposite. Think, no, I'm just going to calmly breathe, and we're just going to reduce. There's no cure for these symptoms, but you can really help reduce the intensity and frequency of them. Tapping into mindfulness apps. Fantastic, wonderful. Making sure you get that good quality of sleep, and making sure that you're thinking about things like CBT is really important. Just, there's a really good self-help guide. Professor Mara Hunter and Dr. Melanie Smith have written a really good self-help guide. I'll put that in the resources at the end as well. It's not often a case of thinking, right, I need to go and find a therapist. There's going to be a waiting list for this. I need to get group therapy. It's going to be a waiting list for this. No, you can start now. You could order their book online. They don't pay me. You could order their book online. You could start looking into CBT. You can have it ordered on your desk probably from Amazon tomorrow. It's as simple as that. Just start doing small things for yourself and start getting that element of control back is really, really important. So naturally, just aware of time. I know I do talk too much, Neil, but we're just aware of time, thinking about excessive alcohol levels. How much alcohol do you really drink? You might all be teetotal. I very much doubt it though, because I need a gin and tonic now and again, but it's knowing exactly how much alcohol you're having in your day, in any daily diet. No more than 2 or 3 units a day, no more than 14 units a week. Binge drinking is really rubbish for all these symptoms. If you're not aware, go onto the Drink Aware website and fill in their questionnaire, and you'll really understand how much alcohol you really are taking in. And it really does exacerbate those symptoms. Same with the caffeine levels. If you can't do that double espresso, have a really good quality of caffeine to start with less chemicals in it. Have that double espresso first thing in the morning, and then make sure that you really don't have any caffeine after lunchtime. And that will help with lots of different symptoms, because it's not only a stimulant, it affects the absorption of nutrients and minerals as well. So just have a knock-on effect on absorption of those, and also then on your sleep patterns, your insomnia, your nocturia, getting up in the middle of the night, exacerbates all that. And then just think how long it takes a cup of coffee to break down. So it might take several hours for you to actually expel all the byproducts out of your system. So if you compound that by multiple cups of coffee in the day, then it's really having an impact, isn't it? Something that you can do for yourself, something that you can control. So instead of counting calories, count your nutrients. How many nutrients are you managing to pack into that diet? You know, just recently, I've got two older children down here in London recently. They're really good cooks, but, you know, I just gave them a treat, gave them a HelloFresh package. HelloFresh don't pay me before anybody suggests. And just gave them a treat and thought, oh, I'll just do that. And then, you know, they're turning their diet around, because they have so many vegetables and such a variety of spices and vegetables and things in those menus, that it makes you start to think, oh God, I could incorporate so much more into my diet, couldn't I? It's little things. It's not big things, it's little things which make a difference. You know, avoiding those fatty diets. At this time of your life, you don't need a fatty diet. You need to be feeding your body what it needs. There isn't a menopause diet. You need to be making sure it's rich in protein. Try and have protein at every meal time. Try and have, you know, making sure you've got a calcium and magnesium rich diet, green leafy vegetables, seeds, nuts, peas, beans, you know, all the legumes, really, really good. You're well hydrated with good clear fluids. You're just, and also remember that not to overdo the hydration. You've got lots of fluids and things like melon and cucumber, for example. So, and try avoid the fasting, because if you're fasting, your digestive system is affected by estrogen levels declining as well, isn't it? So, you know, it's slowing down, your metabolic rate slowing down. So if you're fasting, you're going to slow that down even more. It's going to have the opposite effect. You're wanting to make sure you're keeping that going, and that you're nourishing your body at this time. So eating little and often, making sure you're not eating too late, making sure you're not exercising too late in the evening is really good, and that you're doing that variety of exercise. I'm just going to go quickly onto HRT, so we've got time for questions. Huge topic, this, isn't it? And quite a controversial topic for a lot of people, but it's really good. It's really important for me if I can manage to get across, like, you know, you have a whole spectrum of different ways of coping with symptoms. You've got your lifestyle choices you can take control of very, very easily. You've got your dietary, you've got your nutrition, you've got, you know, you've got your alcohol and caffeine levels, you've got your hydration levels, you've got your exercise levels. These are things that you can easily control and make tweaks and nudges to. You've then got other things like alternative remedies. We'll go into that in a minute. And then you've got medication that you can consider. But you've got to consider what's right for you. And I think if you're informed about HRT, you can then realise that it is a very valid option for the majority of people, and not to be scared of. Benefits outweigh the risks. But where are you getting information from? Here we go back to information. Really, really important. I would never read a newspaper article on HRT. If I was going to get some information on HRT, I would want to know who'd written the document. Are they accredited to write it? Are they practicing within this field of medicine day in, day out? Do they know their research? What date was the document written? You know, really, really important, because time has moved on in the last 10 years. So you want to know that the source of your information is accredited. So I would say, you know, the LSBU, so you will know that. So, you know, I would say a good source to start off with is the Women's Health Concern website. That is, you know, it's regularly updated, regularly highlighted with the latest research. You've got a whole raft of fact sheets on HRT, a good starting point. So estrogen levels declining, you're replacing that estrogen. HRT is made up of estrogen and progesterone, and for the majority of us, we need both components because we've still got our uterus. If you've had a hysterectomy, so you don't have your uterus, you don't need that progesterone component, okay? Your Progesterone is there to protect the endometrial lining. So you're replacing the estrogen, so that's helping to rebalance those hormones, so that helps to relieve and control menopausal symptoms to a certain degree. It also, by replacing that estrogen, you are helping to prevent those long-term symptoms of developing. So you're helping with that bone mineral density, you're helping with that, providing that cardioprotective effect. There's something called the window of opportunity. People go, what is this window of opportunity? Well, it's the safest time to take HRT, and that's within the first 10 years of starting your menopausal symptoms. You wouldn't want to be starting somebody on HRT in their mid-60s, okay? You want to be starting at safest time is within that first 10 years of starting your menopausal symptoms. There's additional benefits, helps to prevent certain chronic disease developing, things like type 2 diabetes, colorectal cancer, Alzheimer's. That's not to say, I'll slow down here because sometimes people have misinterpreted what I said. That's not to say that everybody is obviously going to go on and develop these. We're obviously not. Not everybody's going to go on and develop osteoporosis. Not everybody's going to go on and develop certain chronic diseases if they don't take HRT. HRT isn't for everybody. It's not for everybody. But if you want to have that conversation, it is a very valid option. What is important to point out is that anybody who becomes prematurely menopausal, if there's no contraindications, no reasons why they shouldn't be on HRT, so maybe in their 20s, 30s, early 40s, they should be on HRT from the word go to protect all these organs and all these body systems up until the average age of 51. And then if regularly checked, there's no reason why they can't then go on and carry on with HRT after that. Okay, so the risks, very much down to duration and type, how long you want it for and what type you're taking. The medications that are made these days are a lot more sophisticated. Things have moved on. You know, vaginal estrogen doesn't increase the risk of breast cancer diagnosis, and your cardiovascular risk isn't increased, as I said before, when starting women under the 60. Deep venous thrombosis, pulmonary embolism, as with any hormonal medicine, it's greatest risk within the first 12 months. Think of the contraceptive pill, again, identical, okay? You've got to compare, when we're thinking about that breast cancer risk, you've got to compare other things and put it into perspective. Postmenopausal obesity, so you've got a BMI of over 30, 31, or you're having more than 2 or 3 units of alcohol a day. Those two things are associated with a much greater risk, potential risk of developing breast cancer than having 5 years of combined HRT. The combined is estrogen and progesterone. So 5 years of HRT compared to being obese or having 2 or 3 units of alcohol a day. That really puts it into perspective, doesn't it? Why so many of us, educators and healthcare professionals, bang on about lifestyle choices so much. It is so important, and it's things that people can do for themselves. And that really helps all your symptoms. And then there always used to be that people, you know, it was known that you couldn't have HRT for more than 5 years. That does not stand now because your types of medication have changed. They're more sophisticated now. So there's no arbitrary limit to the duration of treatment, BMS, British Menopause Society. And that's as long as it's felt that your symptom control, your benefits of symptom control and improvement in your quality of life outweigh the risks. In essence, what that means is that if you're put onto HRT, you should be checked after 3 months. That's to check that you're not having any side effects, that it's actually working for you, that you're happy with what you're on, because, you know, it might be the right combination to start with, and you might have to just change that or slightly tweak it. Some people get checked after 6 months, and then you should always be checked annually, okay? Because your body, the HRT doesn't halt the menopause. That's another misconception. Your body's continuing to age, isn't it, and evolve. So, you know, your medication might need to be tweaked as you go along. So after a couple of years of being on it, your symptoms might change slightly. So your medication that might need to change slightly. If you come off HRT, a lot of people will say, oh, well, it's just thrown me back into menopause. You've got to give your body time to adjust to that imbalance again, haven't you? So you've taken out very powerful hormones out of your body, and you imagine that it's just going to go back to normal, back to square one. Well, no, you've got to give your body time to adjust to not having those hormones put in. So it might take a period of time, a few months for time to get your body to settle down. Okay, we'll just move on to alternative options. So CBT, that is the book that you want to be looking at, but it's now they've just done a new edition of cover, and they've just upgraded it slightly, so it's a slightly different cover, but that will still come up on Amazon or wherever, Waterson's, wherever you get your books from. So I would definitely look into CBT as a really good alternative option, not only for menopause, but for any stressful situation, men and women. whoever out there, all people, is just to make sure that you have something under your belt that you can really help to just to reduce those stress levels. And it, whenever it happens, when you're having a hot flush, absolutely. When you're getting irritable and stressed, absolutely. But say if you've never experienced bereavement before, you might, it's a really stressful situation to be put under. Elevated levels of cortisol and adrenaline will be thrown through your body. If you've got some little tools and strategies under wraps, that can really help. Herbs and supplements, err on the side of caution. Some people find herbs extremely helpful. And I think sometimes for the more minor levels, the lower levels of symptom experience, that can be really helpful. But it is unregulated. Make sure that you really are aware of how they interact with other medications. Make sure that you know that they do have side effects. It's not regulated. So I would get advice from medical herbalists, definitely. And they will be able to tell you what's going to interact and how it's going to interact with the body. Same for supplements. Don't immediately just leap and go and grab calcium and magnesium supplements off the shelves. Not everybody is deficient in these minerals. You're much better getting these minerals from dietary sources. And then if you do want to know if you're deficient, then you want to be getting a blood test to find out, because you can overdose on these things, can't you? All these other wonderful options are fantastic, not only for overall health, but also for reducing those stress levels. And if you can't access, or you don't have the funding to access any of these, then there's nothing to stop you, say, doing something like getting your washing up bowl at home and putting some magnesium flakes in your washing up bowl, which is a lovely magnesium, a calming, known as a calming mineral, isn't it? But also fantastic for aching joints and muscles. And it's really, really important that you absorb that magnesium as well through transdermally, so maybe in a foot bath or a hand bath, or actually in your bath. And then you could always massage your own feet and give yourself a little bit of reflexology yourself. Not tricky. Just one last slide, Neil, don't worry. Menopause within the workplace, definitely. Acknowledge the menopause as a long-term health condition. Make sure you're creating those open conversations, really, really important. But, I think for some people, menopause has been smacking people in the face, hasn't it, over the last couple of years? And some people have had their fill of menopause. So term it in a different way, put it under the umbrella of women's health conditions or men's health conditions. Phrase it a little more differently, making sure everybody's educated and informed. Don't have one-off information sessions. Neil has been fantastic, hasn't he, for providing you with lots of different information sessions and a variety of different topics to do with menopause. Really, really important. Keep the lines of communication open and make sure you've got a key figure within your organisation who creates that accessibility and creates that feeling of, that it's fine to talk about this topic, and that that they're there to talk about. Get your menopause policy in place. Have you got menopause policy, Neil? I think you have.
We do.
You do. Marvellous. And it will have reasonable adjustments on there. I know that they'll be able to be put into place simply and quickly, because you hear of awful sessions where they've got reams of reasonable adjustments, and then it can take months to get organisations to put them into place. So make sure they're easy to put into place is really important. Here's your useful signposting. So don't start scribble massively around. This is available later. So don't worry. You've got the Women's Health Concern, patient arm of the BMS, which is brilliant. Wonderful fact sheets on all sorts of different topics as the Menopause Matters. Menopause has got a quarterly magazine. You can access it online. You've got the Squeezy app. Please download that. Your pelvic floor will love you if you do that. You've got the Daisy Network, which is fantastic for anybody experiencing the premature menopause. Fantastic charity, really, really supportive, as is the Eve Appeal for anybody experiencing one of the 5 gynae cancers. Really good. And endometriosis obviously speaks for itself. Okay, and the other 2, that's more about, Women's Health Plan, that's in Scotland. Apologies, I'm from Scotland. And the NHS Inform is a fantastic website, and they've put the menopause platform on there, so that's really good. And there's that link to those CBT books. So that is me, and I'm going to stop sharing now. So we'll just, there we go. Ooh, how am I going to stop share? There we go. There's my button. Have I stopped sharing?
You have. Thank you so much for lots of information and signposting and helping people to break down where to find reliable information from. And obviously we know that your information is super reliable, Ruth. So thank you so much for joining us today. Audience, over to you. There are some great conversations going on in the chat box, people sharing their own experiences and tips and
Oh,
guidance in there as well.
fabulous.
Please do, if you have a question, please do free to pop your camera and microphone on. We're keen to get some live dialogue and discussion going, and ask some live questions. So Ruth, just starting in there, there's a couple of comments about ashwagandha powder, and the
Ooh.
use of that. So is that something you have come across?
That is not something I am familiar with, but I will absolutely research that for you, and I will get my specialist onto that and get you back an answer, and then Neil can he can whiz the information out to you.
Perfect.
So
Thank you so much. So I am going to stop the recording now. So for those of you that are watching the recording, thank you for watching. We're keen not to inhibit any conversation, so I'm going to stop that, and I'm going to hand over to our audience.